Hello everyone, how are you? Today we are going to start about another question regarding MRCS, which will be very helpful for you to prepare yourself for attending in the MRCS exam. We will discuss gradually all the eMRCS question, recalls, Fawzia sheet, and other question if possible. So if you are new this channel, subscribe the channel for more new videos, and we will publish about 2 questions per day per 24 hour to help you to make you prepare for MRCS exam. So let's start. Here the question: a 48 years old woman with end-stage renal failure is undergoing a live donor renal transplant. The surgeon decided to implant the kidney in the left iliac fossa via a Rutherford Morrison incision. To which of the following vessels should be transplanted kidney be anastomosed? So here we can see a 48 years old woman for kidney damage. She is undergoing a live donor renal transplant. Surgeon decide to implant the kidney in the left iliac fossa via Rutherford Morrison incision. So here it is very important that the kidney implanted in the iliac fossa. In case of left-sided kidney damage is left iliac fossa, we easily implant it left iliac fossa by incision Rutherford Morrison incision. To which of the following vessels should be transplanted kidney to be anastomosed? That means the kidney need the blood supply, the oxygen supply, and other nutrient supply, and the kidney has to excrete the excreted product. For this, we have to anastomose the transplant kidney in a blood vessel. So which of the following blood vessel should the transplant kidney to be anastomosed? So here the options are, you can see here, aorta and inferior vena cava, internal iliac artery and vein, common iliac artery and vein, external iliac artery and vein, and inferior epigastric artery and vein. So we have to find out in which of the vessels we can implant the kidney properly for normal function of a kidney, for it is an space for accommodation, because kidney is an organ, it have to be placed in the area which will be comfortable for the kidney. So next, here we can see an image. Here we can see different structures such as it is inferior vena cava, and just side it is abdominal out, and renal artery is marked here. Absolutely, renal artery is here. Then we can see the two kidneys, and here we can see a kidney. This is implanted kidney. So we can see here now the structure here. The abdominal aorta bifurcated into the two terminal branches, two common iliac artery. Then it descend downward, and at this point it bifurcate into 2 points. This is internal iliac artery and external iliac artery. In case of the inferior vena cava, we can see the inferior vena cava terminate into two. Inferior vena cava, it formed by two vein. This is common iliac vein, and common iliac vein is formed by the internal iliac vein and external iliac vein, and the implanted kidney is here. So we can see here the implanted kidney is implanted these two vessels, and these two vessels are external iliac vessels, and they are far away from the large vessel inferior vena cava and abdominal aorta. So here we can see, is it possible to implant above, like this area, if we implant in this area, so it is this narrow place, it is very complicated for the kidney to accommodate its location. So there is every chance of injury during movement, or any other force impacted on the kidney, and if we implant the kidney in the above part, there are the bones, so there is possible to get injured, or there is less space in the above. So the kidney is usually implanted in the iliac fossa, and in the iliac fossa they implanted external iliac vessels, because external iliac vessels, they are larger than the internal iliac vessels, and in case of common iliac vessels, they are narrower space and very close to the bones, so better to not implant there. In the second picture we can see this is kidney here, and it is abdominal aorta bifurcated into two parts, and the common iliac artery, it also bifurcated into two parts. Internal iliac, here we can see the diameter of internal iliac artery, which is very small compared to the external iliac artery. On the other hand, we can see the inferior vena cava, it is formed by two common iliac vein, and common iliac vein also formed by the external iliac vein and internal iliac vein. And here we can see the external iliac vein, its diameter is more than that of the internal iliac vein. So it is now clear that the kidney is implanted in the external iliac vessels. So our final answer is external iliac artery and external iliac vein. Typically external iliac vessels, we can say this. The surgeon decide to implant the kidney, and the other option we can see the aorta and inferior vena cava, which lies in the retroperitoneal area in the above part. So in the abdomen retroperitoneal space, it is very hard to reach, and it is also another challenge to operate any large vessel like aorta and inferior vena cava. Internal iliac vein and artery, their diameter is very less, and they supply all the pelvic organ. So compromisation of the pelvic or compromisation of the pelvic organ blood supply is usually not recommended. Then common iliac artery and vein, they are very close to the bones, so we don't want to keep the kidney in the close to the bones or other structure. Then external iliac artery and vein, they usually close to the pelvis, so here some of the space present, so it is implanted here. Then inferior epigastric artery and vein, they are usually very small, so here not to be implanted. Thank you all. Be okay.